around best prevention practices for Labor Day weekend. As we all know, COVID-19 does not take a holiday. My name is Heidi Bosk, and I'll be your moderator. I have a few housekeeping items. We will start with the presentation and end with the Q&A, so we ask that you hold your questions until the end. And joining us today, we have Dr. Herlihy, State Epidemiologist for the CDPHE, Dr. Samet, Dean of the School of Public Health, and Scott Landis, Supervisor, Air Quality Meteorologist for the CDPHE. And we're going to go ahead and start with Dr. Herlihy.
Great, thank you so much, and thank you for the opportunity to be here and chat with all of you today. So I wanted to start with this figure, which shows you our daily case counts in the state, but also shows you a 7-day moving average of the number of cases. And so this is a great figure to show you, now that we're reaching sort of the 6-month mark of transmission of this virus, where we've been over the last few months. And I also want to specifically take a closer look at what's occurred in the last couple of weeks. So as all of you know, we've experienced now 2 peaks of COVID-19 transmission in the state. The first peak occurred primarily peaking in April, and our second peak occurred in July. If you look at this figure, it looks like those 2 peaks were relatively similar in size. But if you look at actually the amount of testing that was occurring at the state in April compared to the amount of testing that's occurring now, these 2 peaks were actually quite different. And that first peak, we believe, was much larger than the second wave of illness we experienced. It's just that we had limited availability of testing at that time, and so fewer cases were captured. And so the good news is certainly that we have significantly increased our testing capacity in the state, and we are detecting more and more cases as we continue to work on controlling COVID-19 transmission in Colorado. What I wanted to talk about specifically for the last couple of weeks is the fact that we've seen a steady decline since the peak, the second peak we experienced in July. What you see in this figure is a pretty substantial decrease in the number of cases that were occurring day over day in late July into early August. And then really starting sometime in mid-August or so, we saw a slowing of that decline. So a little bit more of a flattening. Certainly still continuing to see a decline in overall case counts occurring in the state, but a little bit closer to a plateau. And so we're certainly watching that trend closely. We know that we're okay if we continue to see a decline. We're okay if we experience a plateau. It's just those shifts potentially upward that would, of course, make us nervous about the potential for increased transmission in the state. Go to the next slide. And this is the figure that I show you to try and represent week over week what our experience is and whether we're experiencing an increase or a decrease in the number of cases occurring in the state, and whether that increase is increasing potentially or accelerating, or if we're seeing a more rapid decline in the number of cases. So once again, what you can see here week over week is in the weeks that are labeled in the blue color, those are weeks where we've seen a week over week decrease in the number of cases. Where the weeks are labeled in red, that's where we've seen a week over week increase, with the darker shade of red being those weeks where we really saw the most rapid acceleration. And so what I've done in this figure is circle a couple of weeks for you. So this represents early to mid-July, where we did see acceleration of COVID-19 transmission in the state. And we believe that there were potentially multiple factors contributing to that, but we certainly believe that one of the major contributors to that increase was decreased levels of social distancing that occurred. And so I want to take a closer look at some of the modeling work that we've done together with Dr. Samet's team to both try and understand what occurred around the 4th of July weekend, and then also try and look at what is occurring currently and could potentially occur over the next couple of weeks. And so the figure on the left is the fit of the model to our hospitalization data. So each of those vertical black bars corresponds to the number of hospitalizations that occurred in Colorado by day. And then each of the colorful lines represent different fits of the model based on different levels of social distancing. So the red line shows you about 80% social distancing, which we experienced during the stay-at-home period of time and early and safer at home. 60% is where we saw some decreases in social distancing, but we're generally in an okay place. And then that 40% social distancing is the fit of the model after the 4th of July holiday, where we really saw this rapid acceleration in the number of cases and hospitalizations occurring in the state. The figure on the right is showing you our most recent model fit of the data to our hospitalization data. And you can see that we're in a good place currently. We're estimating about 75% social distancing. And so that's certainly where we want to be. Again, keeping in mind that our goal is really to try and stay above that 65% level of social distancing. But we know that there's certainly the potential with an upcoming holiday, also with schools back in session and colleges and universities reopening, for us to experience decreased levels of social distancing in the next couple of weeks. And so we've been working closely with Dr. Samet and his team to work on some projections around what the next couple of weeks might be like in Colorado if we were to see decreased levels of social distancing associated with the holiday or those school or college reopenings that I mentioned. And so with that, I will hand it off to, oh, sorry, one more slide, I believe. So this last slide I wanted to share with you before I hand it over to Dr. Samet is showing you estimates of the reproductive number, that R value that we track over time, and show you where we are currently compared to where we've been over the last few weeks and even the last few months. So what you can see here is that really since about mid-July, we've been at a good place. I remember that our goal is to keep that reproductive number below 1. When that number is below 1, that means, you know, every Coloradan is infecting on average less than one other Coloradan. And so that's where we really have the opportunity to see a decrease in the level of disease transmission that's occurring. So you can see the last couple of weeks, we've been in a good place. We've continued to be below 1, probably somewhere in that, you know, 0.8, 0.9 range. And that's our goal, to continue to stay there and to continue to see a decline in transmission in the state. Next slide. And with that, I will hand it off to Dr. Samet to talk us through some of the projections that his team has been working on.
Great. Okay. And thank you, Dr. Herlihy, and good morning to all. As a starting point, what we do is fit the model each week using hospitalizations and produce those estimates, those projections of what the R value is and the social distancing is that you just saw. We then use that where we are as a starting point to say, well, what could happen in the future? These are projections. And in making these projections, we have what if scenarios. And some of those scenarios are certainly not scenarios we want to see happen. So look at the projections as a way of saying, where are we and what are the possibilities of where we could go, and what are the implications of where we might go. So just as a start, of course, Labor Day is coming. Dr. Herlihy showed you this rise and fall that occurred across July, perhaps arising from some relaxation of social distancing around the time of the July 4th holidays. So what I'm showing you now is, what if there were a peak like what happened in July that occurred following Labor Day? So if you look on the left, there's the near-term Labor Day projection showing a bump up that would begin approximately 2 to 3 weeks after the Labor Day holiday, and then continue and hopefully subside as shown here. And on the right, there is a longer term projection showing how that Labor Day peak would come and rise, fall, and track along with what we saw back in July, the smaller peak to the left. And this is the Labor Day peak alone. This is in isolation from anything else that might follow from September with school reopenings, colder temperatures, going back indoors, and so on. So the next slide. The next slide addresses another September event, which is school reopening. And of course, many of our K-12 school systems are opening, and some of the universities are opening with varying configurations of online and remote education. Now, we're not sure exactly what having school openings translates to in terms of changes in social distancing, i.e., the complement, how much more mixing there might be. So, what I'm showing you are scenarios and projections. And we've said, what if school reopening is a 10% degree in the level of social distancing, a 20% degree, or a 30% degree? So, there's a lot of uncertainty here because we don't have data really literally from anywhere at this point about what school reopening means for the social distancing parameter. And of course, it's complicated because it's younger children mixing with adults in schools. But here are some scenarios. And I think you can see that if we had a 10% decrease or a 20% decrease in social distancing, in terms of what I'm showing you here, the case counts, we would not see a bump up. If we go to a more extreme value, and we don't know that this will happen by any means, we do see that the epidemic curve would rise. Since these are projections and we're watching closely, if we began to see an uptick saying, whoops, we might be heading upwards on the wrong line, then this is clearly where the policy levers have to be considered. Next slide. And just now, of course, these are not isolated events in September. And what you see here is now the juxtaposition of Labor Day peak, a possible Labor Day small peak, and the consequences of school reopening. The slide's a little complicated because they're built in on top of each other. But I think, again, what you can see is the Labor Day peak would hopefully come and go. It would be added on to whatever else might happen in September. And you can see the potential bump up if school reopening were to lead to a change in social distancing in the range of 30%. I will say this represents an extreme value, but again, these kinds of projections are useful to being able to anticipate and to be able to consider what could happen, and again, avoid seeing this kind of scenario play out. Now, there will be other events in September and the fall of potential concern. I think if we go to the next slide, and I think just this is critical care need for the same scenarios as opposed to case counts. And then the next slide, I want to here just turn things back to Dr. Herlihy as we look to events that will come or that are in progress. And again, I think here we partner with CDPHE to think about what could happen and to build these different events into and changes into our modeling. So with that, let me turn things back to Dr. Herlihy.
Great, thank you, Dr. Samet. So as we start looking forward to what the next couple of weeks might look like, it helps to have a sense of what the timeline will be compared to when events are occurring. And so from prior experience and estimates we make of turnaround time, we know that it typically takes about 2 weeks for us to see the impact of an event that's occurred. And so if we look specifically at schools reopening and colleges and universities going back in session, we know that those reopenings occurred primarily around the 17th or 24th, some occurring later. And so because of that, we anticipate that the earliest we will start seeing a clear impact from those reopenings would be August 31st. So that would have been Monday of this week. So the next couple of weeks is really when we expect to see potential outbreaks associated with those reopenings and a potential increase in our cases that could be associated with those reopenings if we're going to see those increases. Similarly, for the Labor Day holiday, we anticipate that approximately 2 weeks following that holiday weekend is when we would potentially see an impact. So starting sometime around September 19th. And it's obviously going to be challenging for us to tease apart, if we see an increase in the next couple of weeks, what that might be specifically due to. If it's going to be due to one factor versus another factor, most likely it's going to be multifactorial. But we are certainly going to be tracking the data carefully and trying to identify whether or not we see any sort of impact on the level of disease transmission based on potential decreases in social distancing that might occur because of these reopenings and because of the holiday weekend. Obviously, we're looking further forward to try and anticipate what the influenza season might look like, and really still working on that. And we know that there's a lot of variability from year to year on what the influenza season looks like. So still really trying to understand what the timing of influenza might be and what the season might hold for us. But as we move into the holiday weekend, just a reminder that we really need Coloradans to continue to wear masks at high levels, to avoid large gatherings this holiday weekend, to ensure that they're practicing social distancing and physical distancing between individuals while they are at some of these events they might attend this weekend. Of course, washing hands is always a good strategy as well. And with that, I will turn it back over to the moderator. Thank you.
Great, thank you so much. Now we're going to go ahead and move over to Scott Landis, who will talk to you a little bit about air quality going into the weekend.
Okay, thanks, Heidi, and good morning to everybody. So obviously a complicating factor to the pandemic is the fluctuating air quality conditions we have here in Colorado, and particularly the enormous amount of wildfire smoke that we experienced in August, and that was from both in-state and out-of-state wildfires. Now, our job as forecasters at CDPHE is to warn people about the dangers of wildfire smoke through the various products that you can find on our website. All of our forecast advisories can be found at colorado.gov/air quality. And the one product that we do have that specifically focuses on wildfire smoke is our Smoke Outlook. We do update that twice a day, and we'll discuss both wildfires in state and out of state, along with large prescribed fires that may impact the health of residents and visitors of Colorado. Now, along with the forecast and the advisories, we do give health recommendations at times that can include asking people to decrease outdoor activities, and in some cases, when the smoke is bad enough, just to remain indoors. One rule of thumb that we try to use for folks, if you don't have an air quality monitor near you, you can't really gauge how high the fine particulate levels are. Fine particulates are what you find in wildfire smoke that cause the biggest health concerns. If you don't have an air quality monitor near your area, you can do some certain things on your own to kind of get an idea of, is the smoke at unhealthy levels? And one of those is that you can, if you have a landmark that's 5 miles away that you know of, if you get to the point where you can't see that landmark anymore, you can assume that the air quality is at unhealthy levels or the smoke is at unhealthy levels. Next slide, please. Now, along with the wildfire smoke, we do forecast for all the criteria pollutants, and that includes ozone, which is, of course, probably the most troublesome pollutant here for the Front Range. Thankfully, ozone not expected to be overly high today, but we're going to continue to have a threat for high ozone into the middle and late part of September. Now, there are two, quote, advantages to ozone over wildfire smoke. You can decrease your ozone exposure by being inside. You can't really do that with wildfire smoke, as those fine particulates will really work through every nook or cranny in your house to get inside. And with ozone, you can also usually predict when it's going to be at its highest levels. So in general, with ozone, it's going to be high during the afternoons and evenings. So you can plan accordingly for your outdoor plans. Maybe take that run or bike ride during the morning when ozone levels are lower. As far as wildfire smoke is concerned, right now, things have quieted down quite a bit, thankfully, across Colorado. That might change, though, later this week and also for the Labor Day weekend. We are expecting conditions to become much drier across the state over the next few days. And on top of that, the upper level winds coming out of California may begin to bring some out-of-state smoke into Colorado by the upcoming weekend. And again, we update all our products online. You can keep posted on that at colorado.gov/air quality. Next slide, and I'll toss it back to Heidi.
Great, thank you so much. So now we're going to move on to the question and answer portion of our media availability today. And to do this, we'll use the raise hand function. So if you click on participants on the bottom of your screen, then you can click on the hand icon, and this will let me know that you want to ask a question. I'll call on you when it's your turn to ask the question, and if you could share your name and media outlet, that would be greatly appreciated.
Hi there. Thanks so much for all you're doing for all of us, and thanks for this information. Couple of questions. I was wondering if you have some thoughts on our low numbers right now, that low positivity rate. What do you think is behind that? And also, what do you feel like, so, 6 months in or however long it is, what do you feel like we've learned to date that could be valuable as we go forward into these next few uncertain months?
Great, thank you. Dr. Hurley, would you like to start with that one?
Sure, absolutely. Thank you for the question. So I would say that our low case counts primarily reflect the incredible job that Coloradans have been doing with mask compliance, with social distancing, to really try and decrease the level of disease transmission that's occurring in the state. As far as the percent positivity value, I think that really reflects the significant increased access to testing that we have in the state now compared to previous times. I think, as you know, our goal is generally to have a percent positivity value of less than 5%, having that be a national or international indicator of sufficient testing capacity in a region. And so we're certainly glad to see that we have enough testing occurring in the state, and that people in Colorado are seeking testing and following public health recommendations if they develop symptoms or if they've been exposed to an individual, and seeking that testing about 7 days after that exposure has occurred. As far as looking back over the last 6 months and what we've learned, I think we've learned a whole lot. We really didn't know anything about this virus. It didn't exist, right? Much prior to that. And so, I think we've learned a lot about how this virus is transmitted from person to person. We're learning more about respiratory droplets versus aerosol transmission. We're learning a lot about the important role of masks for controlling transmission. And I think we're really trying to still figure out that balance and dialing in the importance of social distancing and limiting interactions with each others while, balancing the economy and reopening. We've, I think, learned, as I mentioned about transmission, we've learned a lot about how to protect yourself indoors versus outdoors. We've learned a lot about the fact that outdoors seems to present much less risk than indoor environments do. And while we still have a lot to learn about treatment, we're starting to get some answers there. And then I think similarly, obviously, learning a lot about the potential role for a vaccine going forward. I would say we have a lot to learn still about reinfection. We know now that that seems to be possible, but I think we have a lot to learn about what that means for long-term herd immunity, and whether individuals, if they do experience reinfection, will be symptomatic or not, if they'll have a milder case of infection or not, or how much they'll transmit the virus or not. So I think many questions still to answer, but certainly we've come a long way in 6 months. And generally, I'm quite proud of the ability, the Colorado's demonstration of its ability to suppress transmission of this virus in the last few weeks and months.
Great, thank you. And forgive me, I should have mentioned earlier as well that we also have Vanessa on hand if there are any to assist with any questions in Spanish. And so next, I'm going to go ahead and take it over to Meg.
Hi, this is Meg Wingeter from the Denver Post. I had a question about the model, possibly kind of a similar increase to what we saw in July if people start loosening up this weekend. So look, what you showed in June, it looked like we were kind of already seeing an increase, and the R value was up over 1 then, which is a little different from where we are now. So I wonder, do you think those two scenarios are different enough that we might not have as bad a Labor Day increase as we did for 4th of July, or is there still enough disease that it probably doesn't make a lot of difference?
Dr. Samet, do you want to start
Yeah,
with
I'll
some
take that
modeling?
one on.
Great,
And
thank
thanks, Meg. If you had looked at that plot very, very closely, you would see that, in fact, you're right. We would be starting at a better place with a Labor Day small peak than with what happened on July 4th. And the since we're starting down with that R value around, 0.8 perhaps, when we model out the September peak would be a little bit lower than what we observed in July. So you're exactly correct in your question.
Great, thank you. Now let's go ahead. I am going to take it over to Taylor. Yes, Taylor, go for it.
Hi, Taylor Summers for NBC News Radio. I was wondering if anyone could, I heard Dr. Hurley talk about this for a little bit, about any plans to distribute flu vaccines heading into the fall, and any plans to perhaps get more vaccines out there in bulk.
Yes, so certainly we do anticipate having additional vaccine in the state this season. We do know that that's obviously going to be a really important strategy. We know that influenza and COVID-19 can present very similarly, and it'll be critically important to not just control COVID-19 transmission this fall, but also influenza. Especially when we consider the potential impact to our healthcare system, and knowing that, having the two on top of each other at the peak of potential influenza season could be quite challenging to our healthcare system. And so absolutely, I'd say that influenza vaccine is obviously always important, but this season in particular.
Great, thank you. Katie, we'll take it over to you.
Yeah, Katie Eastman with 9 News. I was just curious, with the cases going down and the positivity rate going down, what are you advising the governor to do as far as reopening right now?
Dr. Hurley, would you like to address that?
Sure, that's great. Thank you. So, we continue to monitor the data quite closely. I think as far as watching for changes in the data, our goal is always to be responsive to changes that we are seeing in the data and make sure we're monitoring the data closely to see any potential increases. With the transmission going down, I think we're in a good place. The strategies we have in place right now are working well, and guidance to the governor's office is, from an epidemiologic standpoint, is to stay the course, to move cautiously. I think we've been in a place in Colorado where we've been using the data for decision making, and I think that's really gotten us to a place where we're really seeing lower levels of disease transmission, and so we're in a good place.
So would you advise the governor to reopen any further right now?
I think changes we make that are incremental, I think there's place for those considerations to be made, and I think it's also not just changes necessarily at the state level, but at the community level as well. And so it's certainly not just a role for state government, but for local governments also to be looking at the strategies that are in use in their counties and what might be most appropriate for their counties as well.
Great, thank you. Meg, I'm going to unmute you for another one.
Thank you. This is for Mr. Landis. You said about that we could be seeing some additional wildfire smoke again heading into this weekend. At this point, can you say what people can do to safely do outside over the long weekend, or is it still too far out at this point?
Yeah, thanks for that question. I think a lot of it has to do with the behavior of individual wildfires, which is incredibly difficult to predict days in advance. So my suggestion always is to keep an eye on our website and look and see which advisories, if any, are active. Usually when we do have an advisory in effect, that's when we start letting people know that they should be decreasing their outdoor activities, and especially people who suffer from heart or lung disease. If we start seeing smoke levels like we saw a couple of weeks ago, and we get to that point, then we're asking everybody to stay inside. I'm not anticipating those kind of smoke levels as we go into late this week and the upcoming weekend, but there certainly could be an increase in smoke. And again, the best place to keep up to date on that is our website, and we put those forecasts out twice a day. We keep an eye on the fires, not just in Colorado, but also out of the state, to see what impacts they may have on us.
Great, thank you. Are there any last questions before we close out today? Yes, Katie.
Yeah, I was just curious, when you hear about events like what happened at Vandermeer last night, can you look at if there is any kind of outbreak from those individual events or something like that, or also protests that have been happening over the last few months?
This is Rachel. I'm sorry. Yep, I can take that question. So following events, trying to identify whether transmission occurred at particular events really comes back to our routine case investigation and contact tracing work. So as we identify cases, public health talks to those cases, interviews those cases, asks them about their exposures that have occurred. And it's really when we identify individuals that have multiple exposures in common, that is when we really identify outbreaks or transmission that maybe occurred at events. And so, for the protests, for this recent event in Jefferson County, and for all events that we know about, we're constantly looking for those particular events as risk factors for why someone may have been exposed to the virus and potentially become infected with the virus. So certainly that work is ongoing, but it's really built into our routine case investigation and contact tracing work.
Would you call those events unsafe?
Certainly we know that anytime there are a large number of individuals at an event, that there is risk of transmission. Obviously, we know that transmission risk can be decreased with social distancing practices and mask wearing. But even with those strategies, we know that large events can result in disease transmission.
Wonderful, thank you. Meg?
Thanks. I wanted to just make sure I understood. So it sounds like with the, the schools reopening and Labor Day and the flu season, that there's kind of a little bit more uncertainty than usual of how those things are going to interact, particularly since we don't know the level of distancing that is going to be maintained at schools. I mean, knowing in general, if more people are together, you have, but how that might play out in what we can expect in cases that would be more uncertain than usual. Am I understanding that right?
Rachel, I'll speak to this. I think that there are changes in activities that are coming, and certainly, the major change in the weather that will come that will move us much more indoors that have not happened yet. So, that I think correctly, as you stated, leads to more uncertainty. I think school reopenings stand as a very good example of that. I think we've had relatively little experience even globally around school reopenings to date. There's some places where it's happened. So you're correct. There's more uncertainty as this landscape of what we do changes.
Heidi, this is Rachel. Could I add one more thing for the prior question? Actually, not the specific question. I wanted to just talk about the action step from public health's perspective following attendance at those types of large events.
Absolutely.
Yeah, so sorry, I should have mentioned the action that we ask individuals to take if they believe they've been exposed to COVID-19 or attended a large event. And this is similar to the guidance that we shared earlier in the summer or spring when protests were occurring, which is really, we want individuals who attend those events to be tested if they develop symptoms and be tested right away. But as our guidance is for individuals who have potential exposures, we also want individuals who attend events like that to be tested, even if they're asymptomatic, and to do that around day 7. So just wanted to make sure you guys had that action step from public health and what to do for individuals who attended events that are, mass gatherings.
Great, thank you. Any last questions? Yes, John Daly.
Hi. Yeah, just wanted to see if you might be able to just kind of give our audience a big picture, sort of what bottom line, what you want them to understand about this weekend.
Yes, absolutely. So thinking about this Labor Day weekend, we want Coloradans to continue the practices that they've had in place over the last few weeks that have really led to us being able to control transmission of this virus in the state and see a steady decline over the last couple of weeks. So that's going to include things like, making sure that individuals are wearing masks, avoiding large gatherings, social distancing when both in larger or small gatherings, and washing hands is always an important strategy as well.
Great, thank you. And I think that is definitely an excellent note to end on. Thank you all so much for participating. And on that note, we hope you have a lovely afternoon. And again, if you have any additional questions, you can go ahead and send those to media_info@state.co.us.